Ever wondered about the silent enemy that once paralyzed millions worldwide? Polio? Polio or poliomyelitis is a highly infectious viral disease. It can cause paralysis and even death, especially in children under the age of 5. This crippling disease spreads primarily through contact with the feces of an infected person. Early symptoms might include fever, headache, and vomiting, but as the virus progresses, muscle weakness and paralysis can set in. But the impact of polio goes beyond physical health. It can have a devastating effect on individuals and families. Picture this: children paralyzed by polio may require lifelong care and support. In many communities, polio can lead to social isolation and stigma, further exacerbating the hardships faced by those affected. Indeed, polio was a major public health problem, with an estimated 350,000 cases reported worldwide in 1988. But the war against this enemy is far from lost. The Global Polio Eradication Initiative, a public-private partnership, has been instrumental in the fight against polio. Since its establishment, it has helped to reduce polio cases worldwide by more than 99%. This significant reduction is a testament to the power of collective action and the effectiveness of vaccination. Yet the battle is not over. Insecurity in Afghanistan and Pakistan, the remaining endemic countries, poses a significant challenge to vaccination efforts. Another roadblock is the existence of vaccine-derived poliovirus, which can occur in areas with low vaccination coverage. Despite these hurdles, there is no wavering in the commitment to eradicate polio. The initiative is persistently working to improve vaccination coverage in all countries and to develop innovative strategies to combat polio. The mission is clear, the resolve is firm, and the fight continues. Despite the hurdles, the commitment to eradicate polio remains steadfast. The best defense is a good defense, especially when it comes to polio. Prevention is key, and we've got two main players on the field: the inactivated polio vaccine, or IPV, and the oral polio vaccine, OPV. Given as an injection, IPV is a real fighter, and OPV, taken by mouth, is just as tough. Both are safe, effective, and have been knocking polio down by the count for years. Now let's talk about the new kids on the block. One promising treatment in development is the intrathecal injection of immunoglobulin, a cocktail of antibodies that could protect the nervous system from the polio virus. It's not a cure, but it could lessen the disease's severity and improve recovery chances. Then there's the polio vaccination sleeve, a wearable device delivering small doses of the vaccine to the skin. It's still in the works, but it brings a new level of convenience and accessibility to the vaccination game. No cure exists yet, but these prevention measures and promising treatments offer hope. Remember, polio doesn't discriminate. It can affect anyone. It's a disease that doesn't respect boundaries or socioeconomic status. It's most prevalent in children under the age of 5, particularly those living in poverty-stricken areas where sanitation is poor. But that doesn't mean it's exclusive to these groups. Adults who have not been vaccinated are also at an increased risk. Polio is a formidable opponent. It can leave its victims paralyzed, and in some severe cases, it can even be fatal. However, we have the tools to fight it. Vaccination is our best defense. It's safe, effective, and can protect individuals from this devastating disease. So let's not be complacent. Let's not underestimate the power of this tiny virus. Let's arm ourselves with knowledge and take action. On this World Polio Day, let's raise awareness and lend our support to the Global Polio Eradication Initiative. We are closer than ever to eradicating polio.